Let me introduce myself. I'm Susan Randall, a member of the League of Women Voters of Washtenaw County and this juvenile justice team. And on behalf of the team, I welcome you to this learning session. The League of Women Voters is a nonpartisan education and voter education organization. We encourage informed, active participation in government. And while the League does not support candidates nor political parties, we do take positions on issues that we have studied. And one such policy arena has been the Justice for Kids and Communities Act, which the League has supported. There were, in this last session, 19 bills that were presented in the landmark Justice for Kids and Communities Act, and we are pleased to say that the broad act passed this session and were signed into law by Lieutenant Governor Garland Gilchrist on December 12th. Here to help us understand the reform opportunities unfolding for juvenile justice in Michigan at this moment is Jason Smith, the Executive Director of the Michigan Center for Youth Justice. Jason served on the Governor's Task Force on Juvenile Justice Reform, which recommended, after 18 months of study, 32 reforms, and they released that report in 2022. Which then laid the foundation for the bills that just passed and the transformation that we're about to all participate in. During Jason's presentation, I will invite you to submit your questions using the chat function at the bottom of the screen. We will address those questions at the conclusion of Jason's prepared remarks. But if you add your questions as you go, it will help to make sure you don't lose the thread of something that is important for you to learn more about. All right, I think that with this overview, we are ready to launch into Jason's remarks. Jason?
All right, well, thank you, Susan. And thank you, everybody, for attending. Happy New Year. I think this is my third time presenting to the League of Women Voters. Again, Jason Smith, Executive Director of the Michigan Center for Youth Justice, and we're a nonprofit advocacy organization that's focused on reform of the juvenile justice system, just to ensure that it's fair and effective in how young people who come in contact with it are treated. They're making sure that young people are protected from harm and also given every opportunity to thrive. Our motto is kids are kids. Even when they get into trouble, they're still kids. And so that's why I was so excited to participate in the governor's task force for juvenile justice reform and support advancing the recommendations. And then our organization, along with partnering with a lot of the same stakeholders that comprise that task force, to advance the aligned legislation. I would say, as an advocate who's been doing this work for almost 10 years now, this process of passing this legislation was the most fun because there was so much consensus behind the recommendations and the proposals outlined in the legislation. All right, so I'm going to get started and share my screen. Right, so here's me, same photo as Susan. So just presentation outline. So I'll just do a quick legislative overview. For those who have attended previous presentations or have kept track of the legislation, I still think it's important to do a quick run through just because there were a few amendments that were included when the legislation passed, which was actually on the last day of the legislative session. And not all of the bills included in the legislation made it to the governor's desk. So quickly touch on that. Then start to talk about some of the statewide implementation efforts that are happening around implementing the legislation. Touch briefly on local jurisdiction implementation efforts, just a couple of examples. And then a couple of questions that some of the audience members may want to pose to their local juvenile jurisdiction or juvenile justice system stakeholders around implementing the reforms. And this is, even though I know this is a Washtenaw specific audience, I want to be clear that when I'm presenting this, I'm presenting it as someone who's not completely familiar with everything that Washtenaw's juvenile justice system specifically is doing. I'm glad there are stakeholders from um, the trial court and the JJ system here that may be able to answer some questions or may participate in follow-up presentations down the line that can really get into specifics. I'm really going to talk about the reforms broadly and speak to things in ways that any jurisdiction may cover in regards to implementation. Phone, so I'm keeping track of time. All right. So as Susan mentioned, and I won't spend too much time on the legislation that was recently signed into law was informed by the recommendations of the Juvenile Justice Task Force. I served as a member of it. It was a diverse group of stakeholders, included judges, sheriffs, court administrators, advocates like me, members of the juvenile defender community, young people who were impacted or involved but in the justice system, family members as well. It was chaired by Lieutenant Governor Gilchrist. That picture that I included is from the day when the bills were actually, I mean, the recommendations were actually passed by the membership. And there's me, my tie looking weird. And the final report was issued July 2022 with 32 consensus-based recommendations. Overwhelmingly, the recommendations were supported unanimously. There were just a few that weren't, but even those were supported with majority vote. And several of the recommendations were translated into legislation. And so the legislation really, the issue buckets that came from the recommendations that were translated into legislation this session were really those that were, one, considered those that had the strongest consensus, those that were considered maybe by some of the legislature or those who have to advance the bills as low-hanging fruit, but then also the recommendations that were really foundational, transformational. I don't want to diminish that in the way that it will change the juvenile justice system for the good and improve outcomes for young people, but really foundational in that it provides the structure for additional reforms and additional recommendations to be translated to legislation in the future, all with the goal of creating baseline standards and the quality of care and supervision that young people have when they come in contact with the juvenile justice system statewide, and to try to reduce some of the variances that can be harmful in a young person's experience in the juvenile justice system, what we call justice by geography. So a young person's experience really differing vastly just based on where they live because of the policies and practices in the local jurisdiction and the policies at the state level that govern them. So on December 12th, 2023, the majority of the Justice for Kids and Community Bill package was signed into law. The only bill that was not passed by the Senate, where it currently stands, is House Bill 4630. And that legislation would authorize funding to establish training standards and resources for youth defense and legal representation within the Michigan Indigent Defense Commission. The concern was around cost of implementing new standards related to youth defense. Right now, the Indigent Defense Commission standards only cover the adult system, or young people who are waived to the adult system have access to those research and standards and training, but there's nothing that covers juvenile defense in the juvenile justice system outside of the state appellate defender's office, which I'll touch on in a second. But the hope is that that legislation will still pass this session. Again, it's at the final step, right before reaching the governor's desk, waiting for a floor vote in the Senate. We're hopeful that the issues around costs can be addressed. But the argument is that young people deserve quality defense representation. And ultimately, folks like me, advocates, believe that you will see savings from improved quality defense by ensuring that young people are receiving the right treatment, or have access to quality care, and are not recidivating because of receiving quality defense and having a good treatment plan that's aligned with their needs and their risk, and so on. And then another item around the legislation is that the effective date for all of the changes of the bills is October 1, 2024. That aligns with the state budget. And so anything related to funding and all of that could be aligned with the state's fiscal year. The exception being the changes to the Office of the Children's Ombudsman, which went into effect immediately once it was signed into law. All right. So just a quick overview of the legislation that passed. Again, they were encompassed in several bills, 20 bills in all. So I'm really just framing them as issue buckets. But I can, once we get into the question and answer section, there's a link on MCYJ's website that does a really good job of breaking down all of these issues into the actual public acts. So you can see descriptions of the individual bills, and then we have hyperlinks so you can see the actual public act as well. So the first policy reform we want to touch on was changes to the Child Care Fund. Child Care Fund, for those who don't know, is the primary state funding source for juvenile justice. The way that it works, just briefly, is local jurisdictions through their county budget pay for most of the expenses for juvenile justice upfront, whether that's community-based care or out-of-home placement, so short-term detention or longer-term residential placement, and the state reimburses them back 50% on the dollar. So the reform related to the legislation, the biggest one, which I think really changes the funding structure and the structure and the system overall, is to incentivize community-based services by changing the reimbursement rate for community-based care from 50% to 75%. To encourage communities to expand their menu of services that they offer in home, reduce the use of detention and longer term residential placement, because research shows that young people fare better and have better outcomes when they can be served in their community, continue school, stay with their family as much as possible. It also expands what the Child Care Fund can be used for. So it includes things like allowing young people to have access to programming and services before having a charge referred to the court. So if there's just some sort of referral or complaint saying that a young person is starting to show the signs of delinquency or may have been participating in risky behavior, they will be able to have access to child care funded programming. And it also will allow it to be used for pre-arrest diversion as well. It expands the definition of community-based care as well to include emergency shelter and respite care. Often there are young people who find themselves in detention because of issues in the home, maybe a domestic violence issue or just conflict with their parents, which may require removal from the home short term while some sort of emergency planning or issues are worked out with the family, or a safety plan is put into place, but doesn't necessarily require a stay in detention or longer term residential care. And it also could benefit young people who are placed in detention, but even the court may have determined aren't a risk to themselves or the general public, but can't go home for whatever reason. Either the family does not want them to come home, unfortunately, or the family may be experiencing housing instability themselves. It just provides alternative options to confinement for kids while they can remain in the community. For risk and needs assessments, it requires the use of objective decision-making tools to match youth with suitable supervision, including diversion. and other community-based services based on their risk to reoffend and their needs, I should say as well, but then also guide dispositional decisions. Also in the legislation, there is there's language that states that the state court administrative office will help to determine a detention screening tool to be used statewide to help determine whether or not a young person requires admission into a detention facility. As I said, it expands opportunities for pre-court diversion and consent calendar. Consent calendar is similar to diversion in that it's an informal docket that's used by many courts. I've seen it used in many ways. Sometimes there are courts who don't have a pre-court diversion option at all, and they just use an informal docket as their way of diversion. There's other courts who use consent calendar and this informal court docket as a middle ground. Kids who may not require full-on probation supervision, but they require a bit more hands-on and a little more supervision than a young person who is participating in some sort of pre-court diversion program where they're typically referred out to the community. They complete whatever their agreement is for diversion. And if they stay out of trouble, then that's usually the end of the story there. There's some standards put into place in the use of diversion around the length of time a young person can stay on diversion. Right now, both the legislation for diversion and consent calendar, what passed and was signed into law, states that that the length of stay cannot extend beyond 90 days unless there's a need that's justified within their treatment plan to extend beyond that. For consent calendar, there is a chance that may be changed in the next legislative session to extend that to 6 months. And that was actually what was agreed upon by the Juvenile Justice Task Force, that difference, even though it didn't make it into the final bill, just acknowledging that consent calendar in many ways is used differently than pre-court diversion. And then debt-free justice, something that we're very passionate about, was there was legislation included, which again was a recommendation voted on unanimously by the task force to eliminate all fines and fees associated with juvenile justice involvement, except for the Crime Victim Rights Fund fee, which I actually don't know how much that is. I want to say it's between $50 and $100, but somebody in the court might be able to tell me that. And then restitution. But everything else, the cost of care and supervision, I mean, we talked to, during this process, both the task force and educating lawmakers on this legislation, talked to so many parents around the state that experience significant costs related to their young person's stay in detention and residential care. And every county is different. I know that Washtenaw, for example, had a pretty stringent waiver process or income verification process to waive fees, but across the state, that wasn't the case. And we talked to families who owed, over $100,000 in just fees related to out-of-home placement and detention alone, not counting restitution, repairing harm to a victim, anything like that. And luckily, the legislators and I would say the juvenile justice stakeholders who voted for this recommendation acknowledged that placing financial harms on families is not the way to have a collaborative relationship with young people and their families. And engage them effectively in treatment. So removing this financial burden allows young people and their families to focus on their treatment plans, focus on their treatment, being held accountable in other ways, but focusing on what they need to do to satisfy the orders of the court, repair harm to any victims, and then move on with their lives. There was legislation that renames and expands the role of the Office of the Children's Ombudsman, which is a state level office. It expands the powers and the duties of that office to include residential facilities that provide juvenile justice services. in the state operated, county operated, public and private. It adds that a judge for a juvenile receiving juvenile justice services may file a complaint with the Office of the Child Advocate. It added that the Office of the Child Advocate can mediate issues and educate the public regarding complaints dealing with certain agencies and facilities that serve children. And it also added that the office must open a preliminary investigation when a child is committed to a residential facility dies. And each residential facility must publicly post information about the Office of the Child Advocate so that young people, their families, staff working in the facilities are aware of that office in the process to be able to file a complaint. The legislation expands the state appellate defender office to include appellate services for youth, and that includes post-dispositional services. So again, this is just focused on appeals and separate from the other legislation that would expand the Michigan Indigent Defense Commission for juvenile defense standards and training overall. And then there was legislation that adds developmental factors that a judge must consider in waiving a young person to the adult system. That includes the adequacy of rehabilitative services and the youth's amenability to treatment, the young person's developmental maturity, mental and emotional health, and then also the impact of the victim. And it removes school records as information that can be used as criteria by the court for waiver and designation decisions. And then the final one is really around allowing the Michigan Department of Health and Human Services to have flexibility in changing per diem rates for residential facilities to address issues such as bed shortages, which we're currently experiencing in the state, staff retention issues, and service needs. All with the goal of ensuring that young people for whom all options in the community have been exhausted or not, it's impossible to keep them in the community, that they're receiving quality care in a longer term residential treatment facility, but also that there are placements available based on their need, and can address their issues, and that they're not just being placed wherever there's a bed available is one of the goals there. And so digging into the statewide implementation effort. So even before the legislation was signed into law, there was already work underway to engage various JJ stakeholders into conversations related to implementing these task force recommendations, both those that are already passed into law and then others that don't require statute change, and also setting us up to be able to quickly discuss and work on potential additional reforms that may come down the pipe. And so just wanted to highlight a couple of examples here. One is the Child Care Fund Advisory Committee. That's mostly comprised of staff from MDHHS and juvenile justice system stakeholders, so judges and family court administrators. And they're tasked with implementing the changes for the Child Care Fund. The advisory committee has been broken up into 4 committees. The admin rules and handbook. So DHHS maintains a policy handbook for the Child Care Fund, which is quite significant, but outlines a lot of the policies that govern the use of the Child Care Fund by the juvenile courts and local DHHS offices, who are the only entities that can be reimbursed by the Child Care Fund, by the way. And even the legislation that I kind of outlined before in the bills related to changing the reimbursement rate to 75% for community-based care and expanding diversion and so on, the language was included that says that the department will create guidelines or policies within their handbook to govern these changes. And so I know that a lot of local system stakeholders are really looking to what's ultimately in this handbook to help guide their decision makings and expanding their continuum of care and changing their system to reflect the changes in the legislation. So the admin book will rules and handbook committee will regularly consult with JJ stakeholders for input on rule amendments and review these proposals in various subcommittee meetings. There's an annual plan and budget subcommittee that works to continuously improve and streamline the budgeting process. Local jurisdictions submit their budgets to DHHS for the Child Care Fund every year and reimbursed mostly on that. Establish clear documentation standards and effectively manage timelines and data insights for program funding under the Child Care Fund. There is a monitoring review process that DHHS undertakes with local jurisdictions to ensure that the local courts and counties are in compliance with the rules of the Child Care Fund. This subcommittee, their objective is to refine the on-site review procedures to align the Child Care Fund policies and integrate the legislative reforms. And then the Program Eligibility Protocol Subcommittee, they're tasked with developing criteria for evaluating programs that are eligible for the Child Care Fund reimbursement, establish a clearinghouse for approved research-based and promising practices. And then also I know that one of their objectives is to develop a protocol for supporting programs that may not be research-based, but may be beneficial to young people or improve young people's outcomes that are involved with the system. The Michigan Juvenile Justice Partnership Committee, this is a collaborative between the Department of Health and Human Services and the State Court Administrative Office. Really serves as, I would say, like an umbrella committee to try to encompass a lot of the work that's happening around the state within other committees, but then also work that various associations, such as the Michigan or the Michigan Association of Family Court Administrators or the Judges Association may be doing to support implementation in their own communities. Having just a space where everyone's updating the various stakeholders on this process, and as well as having their own work groups too. And I am appointed to this committee. I'm serving on the Data and Quality Assurance Work Group. That the objective of that work group is to ensure that the juvenile justice information is defined and interpreted in a uniform way across the state, and that the collection and sharing of data is accurate and timely. I know that one of the things that they're going to work on is establishing a data dictionary that ensures that all jurisdictions are using the same definitions when reporting data to the State Court Administrative Office. They're going to determine what data should be shared with the State Court Administrative Office and ways in the process for evaluating data and analyzing data. I'm really excited about that. I'm someone who am a big proponent of not just having data to inform the system and change practice, but also it's important for transparency's sake. You know, the juvenile justice system is a public taxpayer-funded institution. And the more data that that the general public and the legislators who represent them have to understand how our system is working, both at the statewide level and locally, I think it's better for the state and young people as a whole. There's a training work group that will develop a cohesive strategic plan for juvenile justice training for stakeholders to ensure clear and consistent training, so that can run the gamut from implementing these risk and needs assessments and using them to fidelity, or programming, ensuring that evidence-based programming is being utilized to fidelity as well. Ensuring that new juvenile court staff, new juvenile probation officers or court officers have adequate training to be prepared to do their work. And then the policy and procedure work group will discuss implementation of the policy and procedure changes that would be required by the juvenile justice reforms recommended by the task force. Of course, there's going to be some overlap there with the Child Care Fund Advisory Group, but also thinking about things again like implementing the risk and needs assessments, the detention screening tool, but also communities who have to shift their system to prepare for the change in eliminating fines and fees. And what does that look like? And how do you inform families about that change? And how, if there needs to be some sort of change in their process to separate out the Victim Rights Fund or the other fees that they're collected. That work group will cover things like that. The Juvenile Residential Facilities Advisory Committee. I serve on this committee as well. This is a committee staffed by DHHS, but still also comprised of various stakeholders, courts, members of the advocate community, impacted families, folks from the child welfare system, education, folks with education backgrounds or from the Department of Education. Trying to think of others, private providers. I know that the two state facilities, their directors participate as well, all to look at what, as we shift to a more community-based focused system that emphasizes keeping kids at home versus utilizing confinement or detention or placing kids in child caring institutions like residential treatment facilities. What does the out-of-home placement system look like for those young people who will still find themselves in placements outside of the home? And so this committee is broken up into 4 different subcommittees. The residential committee, which I'm co-chair of, is looking at refining residential standards for youth placement, looking at placement criteria, looking at the offense types, demographics. What are the baseline service array that residential placement should be providing around the state? Again, going back to the previous slide around training, one of the things we're talking about is if there is a way to build to scale some statewide training for residential providers around standards of care and services that they should be providing. What does that look like? And what is the need that's being identified by local communities, by courts and others that young people need who come into the system? Establish uniform service agreements and per diem rates, and focusing on safety, education, trauma-informed practices. We're also having conversations about what does a uniform process for reentry look like to ensure that once a young person is ready to come home from a residential placement, they have everything that they need to be able to reacclimate back to their community and thrive, including returning to school, whatever that looks like, continuing any kind of treatment that was happening in the residential placement, access to continuing medication and so on. The Bed Management Subcommittee, they're tasked with developing and implementing a comprehensive plan for statewide juvenile justice bed management, case reviews, and data collection, and creating a unified data system for bed tracking and utilization. And so I know just from, and these groups, these subcommittees really started their work, I would say, in October and November, and then kind of took a slow pause during the holiday season and are starting to ramp up again. But the bed management work group, they're really focusing on developing this bed management system so that across the state, local jurisdictions, DHHS, others, all have a general understanding of what beds and what facilities are available, so that we can minimize the amount of time of trying to track down a bed for a young person to be placed in, and hopefully reduce wait times as well. Case management standards, really focusing on case management while a young person is placed in a residential facility. Again, with the idea that reentry starts from day one. When a young person is placed in an out-of-home placement, there should be case management protocols that's really focusing on helping a young person address their needs in placement, but also putting the things in place that are needed to prepare them for eventually returning home. So ensuring that there's consistent assessments happening, tailored services, and data-driven quality assurance. And then the detention work group, which I probably started this out of order. They're tasked with developing a comprehensive plan for detention facilities to ensure the high quality, safe care, and expansion of regional support services, and an alternative placement options. I know that some of the things that the detention work group is working on is admissions criteria, or even baseline training for staff around what searches look like. Or I know that they'll eventually get into policies and practices around the use of restraint and seclusion, and what does that look like in detention facilities, which is I know is a hot topic amongst juvenile justice stakeholders. I should note that Kevin Mitchell, I don't know if he's on this call, but the director of the Washtenaw County Youth Center is the co-chair of that detention subcommittee, and he's been doing a really good job, and they've been working through their tasks really well, co-chairing that with the juvenile court administrator from Genesee County. And then now I wanted to just highlight a couple of examples of local implementation efforts. I really like to highlight Macomb County. They're a county that is really progressive in looking to implement best practices in the juvenile justice system. For example, they were a county that was strongly on board with implementing Raise the Age back in the day to bring 17-year-olds into the juvenile justice system. Washtenaw County was too, so I don't want to diminish our own county, but and they were a county that early on eliminated juvenile court fines and fees, and really served as a model for the statewide reform. They eliminated everything that was encapsulated in the legislation before the bills passed, and testified in the legislature for why they did that in support of the legislation. So just I saw an article in the news recently from the court administrator kind of outlining some of the things that they're considering and expanding their continuum of care with the changes to support more community-based care through the Child Care Fund. And some examples are homework support and services, expanding their educational services for young people, expanding individual and family therapy, including hiring a therapist, a court-based therapist, expanding vocational services. This is something that's really a passion for me and the Michigan Center for Youth Justice, is whenever possible, supporting young people who come in contact with the justice system by offering life skills training and support for things that will benefit them when they're no longer court involved. Aside from whatever the issue is that brought them into the system, putting them in a position to thrive once their court supervision ends. So vocational services, job skills training, employment readability services, multi-systemic therapy in partnership with the Macomb Community Mental Health Authority, or their association there. Multi-systemic therapy is an intensive therapy that really looks at the environment and the conditions that really contribute to a young person's behavior, and interacting with those different institutions and environment factors that impact a young person. Recreational activities, looking at things that support young people in the evening and in the week, during the weekends, and expanding their diversion options. So just one example, and I've been talking to courts across the state to kind of see what they're intending to do with this change to the Child Care Fund, and any kind of savings they may receive from that change in reimbursement rate. And it's that's just one example that covers a range of things. But I mean, I've heard of creating day treatment programs for kids who have been removed from school, or require, even if it's for a short term, day-long supervision and access to treatment, using the child care funds to support that. Also looking at addressing issues much more upstream, like school truancy, or other status offenses, which are mainly low-level offenses that young people experience, but aren't necessarily high-risk offenses, or predict that they will commit something more serious in the future. Using the child care fund to serve kids much more upstream. And then here in Washtenaw County, I wanted to highlight that the Washtenaw Equity Partnership, which is a group that was formed in 2021 to address racial inequity in the criminal and juvenile legal system here in Washtenaw County, was a multi-stakeholder group. It was comprised of county stakeholders, folks from the education system, advocates. I participated on a work group that was chaired by Perry Stone from the Student Advocacy Center. Just a range of stakeholders looking at ways to reduce racial disparities in the criminal and juvenile justice systems, while emphasizing shifting resources to prioritize safe communities and minimize justice system involvement whenever possible. This group, a lot of the conversations that were happening, especially in the work group that I was on, supporting youth development, looking at education and juvenile justice. A lot of these conversations were happening at the same time as the Juvenile Justice Task Force, and some of the recommendations of the task force it influenced the work of the youth justice focused work groups. But also there were recommendations developed by the Equity Partnership, really based on the data that they had alone from the Washtenaw County Trial Court and interviews with stakeholders, residents, and service providers. There were 65 recommendations in all, organized into 5 categories. And like I said, there was one of the strategies was focused really on supporting youth development. Once I stop talking and we get into Q&A, I can link that report if somebody hasn't already, so you all can see. I do want to share, and I can share this in the chat as well, that the Interfaith Peace Council, they are hosting a presentation tomorrow. I believe it's virtual, on the Washtenaw Equity Partnership report, and giving an overview of it. That if you want to learn more about that report and see some of the recommendations, really dig into the juvenile justice data and the recommendations related to youth justice, you'll have the opportunity to do so. And then I know that there will be a separate town hall meeting hosted at Washtenaw Community College in February 2nd. And once that information is shared with me, I was waiting on someone to send it along. I can share it with the League of Women Voters to share with the audience. But just an example of a local jurisdiction using their own data to help implement some of the task force recommendations and come up with their own separate ideas for how to improve their own system and improve outcomes for young people in their community. And again, like I said, when talking about Macomb, across the state, counties are at different starting points with these reforms. And so implementation is going to look differently depending on the county you're speaking with. There are counties who already use risk assessments to help determine case planning, from diversion all the way through reentry back home to the system, to the community. Some use it to fidelity, some may have some work to do on that, but already utilize them. There's counties that have robust menu of community-based services, and so they're going to benefit from this change in the reimbursement rate to 75%. And there's other counties who are going to have to invest in expanding their continuum of care for young people, and then down the road they'll hopefully see some savings from that change. So again, it just varies. And that's one of the hopes from the statewide groups is that the recommendations and the work of those statewide work groups and committees will help support the local jurisdictions in implementing these reforms. And then I wanted to highlight one recommendation of the task force that was not included in the legislation, and there was no funding included in the state budget for it, but it was something that was voted on unanimously, and we believe is important for successfully implementing specifically the child care fund change, and that's this idea of cross-system collaboratives. So really creating a place where the juvenile court stakeholders, child welfare, education, community mental health, and others can come together and talk about coordinating the child care fund to really ensure that it's being leveraged and utilized to the best that it can to support young people. Unfortunately, well, I don't want to say unfortunately, just based on the composition of the Juvenile Justice Task Force and the fact that the Child Care Fund is only reimbursable to courts and local DHHS offices, a lot of the recommendations and the relevant or the related legislation is very court-centric. That does not mean that juvenile courts alone have to be or should be responsible for determining what community-based services look like, especially when we're talking about pre-court diversion. And so our hope is that whether it's through increased funding down the line at the state or just local jurisdictions working to implement these cross-system collaboratives, if they don't exist already, several communities already have existing human services collaboratives that could incorporate this child care fund work within it, but that it becomes really a community-wide effort to identify gaps within the system for young people who come in contact with it, to expand services and resources that young people have access to, but also start to have conversations about preventative services that may not be covered by the child care fund, but ways that ultimately these savings and the changes that are being made to the child care fund can even benefit kids even further upstream. And then going a little long, so I want to make sure I have time for questions, but just a couple of questions that I thought it would be good for communities. Again, doesn't necessarily have to be Washtenaw, but for the audience to think about and asking their local system stakeholders on how they're preparing for implementing these legislative reforms, specifically the child care fund, is how will the increased funding for the child care fund be specifically allocated to expand diversion options or community-based services and alternatives to detention and incarceration? What is their plan? Similar to what Macomb kind of outlined in the news article that I mentioned. Can they detail the process of using validated risk and needs assessments and screening tools and making decisions around diversion, detention, and the disposition of juvenile cases? And in what ways are local stakeholders being prepared or trained to implement these new standards and practices effectively? If you're a community, for example, that currently does not utilize a risk screening tool to drive case planning, how are you training outside from any training that they may receive from the state level, preparing their staff for this change and how it's going to impact decision making? And then the final one is, and I've heard this from a couple of communities around the state, is a concern that the savings that counties will see from this child care fund change may not be reinvested into community-based services for young people and may just go back to the county coffers or whatever they plan to do with it. Will the county reinvest those savings from the child care fund into expanded programming for youth, and including prevention services? So not only using that savings to expand services for kids who may be court involved or at risk of becoming court involved, but really is there an opportunity to use savings to address the needs of kids before they ever come in contact with law enforcement or school discipline or anything like that, to really prevent any kind of contact in the first place. I think that is it. All right. I'll open it up to questions. I'll stop sharing my screen.
Thank you very much, Jason. That's an excellent overview, and I do especially appreciate your summary there about questions for us at the local county level to address, monitor as advocates, pay attention to. I'm going to shift to the chat. First of all, the crime victim fee for delinquency cases in Washtenaw County, David Baubier was listening, and he said that fee is $25. Just
Thanks, David.
yeah. And then a question about the website that you mentioned where the bills with amendments were lined up with task force recommendations. And thank you, Susan Ashmore, for providing a link in the chat to that website at the youthjustice.org on implementation link. And various people in their narratives said they had tried the link and it worked. So thanks for that. When looking at the waivers to the adult system, Jenna Blair asks, when the use of school records was removed, this was in waiver to adult system, does that include special education records?
You know, I don't know the specifics of that. I would assume, but I don't want to give you the wrong answer. I can check into that and follow up.
Okay, let's move on then. In what department of state government does this Office of Child Advocate reside?
I want to say,
Now, Adriana Parent has weighed in with a link to it. It's just michigan.gov. Isn't clear in the webpage link where.
yeah, I always thought that it was independent.
Okay.
It's independent from the Department of Health and Human Services, independent from the LARA, the licensing department, that it was an independent agency.
And Adriana comments, sorry, it does say it's independent. So that's, I mean, that's always a good structure for a child advocate or a office with a role that it has.
And the department also is responsible for licensing facilities and ensuring that they're maintaining their licensing standards. They're responsible for investigating violations, which may be, you know, come from a complaint, but may not. And so this is really a separate effort, really focusing on investigating complaints made.
Yeah, excellent. Just an affirmation from Susan Ashmore that these changes are very exciting. And she says, yay. And I think especially she's relating maybe to your commentary about what's happening with data to establish data reporting protocols and definitions and being in a better position as a county and state to know what's actually happening with youth so that if there are trouble areas, we can actually design programs that respond to those without data.
Can I add too that
yeah,
in addition to that, that work group on the JJ Partnership Committee, the State Court Administrative Office received a significant federal grant to establish a data management system. And I've been invited to participate in that work group as well. I'm really excited. I mean, I think that the State Court Administrative Office, they're really interested in expanding use of the data that they already collect and collecting more, but also being transparent and how the operations of the court and what the data shares. I mean, they've already changed their annual caseload reporting from previous years to have an interactive web page. But I'm hoping that in the future we'll see more in a really robust annual report on the juvenile justice system every year. There are some great examples out there, like Pennsylvania, and I'm trying to think of another one, Oregon, Arizona, that do a really good job of sharing data on the juvenile justice system around a range of topics, both at the statewide level, but then breaking that down into individual counties. Not saying that each individual county can't do their own annual report, share their own data, but having a statewide hub for juvenile justice data, I think is really important, and I'm excited to be a part of that process.
Another question regarding the bed management plan and system. Will juvenile detention facilities be included within that system?
I'm not sure yet. I would assume so, but I think that they're still working through that process.
Heather Martin has included a link in chat to the Washtenaw Equity Partnerships event at Washtenaw Community College that you referenced. Jason, thanks for that. And thank you to Heather for putting the link in for people to know about that coming up on February 2nd.
Thanks, Heather.
And also a link to the Washtenaw County Equity Partnerships website. So both of those are useful. Belinda Doolin, thank you, Belinda, for providing that. Belinda says, thanks, Jason, for this important information. League of Women Voters appreciate the event and take care all. Leah Mills, have there been discussions on the concurrent programming assistance through the Child Care Fund for the parents? She adds, because absent that, meaning consideration of parents, efforts with the children become almost futile. And another person gives a thumbs up to that statement. I don't know if you have any response, Jason.
Yeah, I'm not on the advisory committee for the Child Care Fund. So I think some of the updates that I'll receive will come from being a part of the JJ Partnership Committee, that umbrella committee I spoke about. I know that has been conversations that have come up in other communities I'm a part of, the residential committee, for example. And it's a long-standing need that several juvenile courts and others have kind of outlined, a need for more programming to support parents. So we'll see on that.
Thank you. That is an ongoing and clearly important issue. Kendra Abrams asks, can grant funding be used for nonprofits and violence prevention offices to begin helping parents navigate the system and conduct training? That would be funding to nonprofits around this area, violence prevention training, and then working with helping parents.
Yeah, I mean, I think it can. I mean, again, I'm not an expert on the Child Care Fund and what programs are eligible and what aren't. But typically, what's been happening even before these legislative reforms is that courts will either use the Child Care Fund to create programs themselves in-house, or they subcontract out. And so long as they meet the criteria for intensive supervision, or the goal of preventing the use of out-of-home placement, a range of things from education services, substance abuse, like down the line have been accessed. I mean, you could utilize Child Care Fund funding for. So with the emphasis on evidence-based programming and promising practices, we'll see how that looks ultimately when they develop the handbook criteria. But I don't see why it couldn't, even now.
All right. So I think that I've completed the questions. Oh, here's a couple further comments. Leah Mills asks, how can one participate on the training committee? And another, Ms. Johnson asks, how can one join these task forces and what is the criteria? So I don't know, I know they're already underway.
Yeah, they're underway, and I don't know. I mean, I'm happy to ask the leaders of those committees if new members can join. But my understanding is they were like by invite, and a lot. For example, for me, I was invited partially because of my participation on the task force, and so there's you see a lot of overlap between the members of the Juvenile Justice Partnership Committee and the governor's task force on juvenile justice reform. I think the goal was to create a space for the members of that committee to continue to serve and implement future reforms too, beyond or the recommendations that weren't implemented yet from the task force.
So one final question, we're just slightly over the 10 o'clock conclusion time. Will the slides be available, and would it be possible, is there a vehicle to get them even today?
Sure. Yep, we can send that
Where might
right
they,
when we're done.
would you be sending them to us then at the
Yes.
league, and then we
Yep.
could distribute them to participants?
Yes.
All right, we'll give it our best, and we're ready to say thank you very much to you, Jason, for your presentation today, the thoroughness of putting this together and giving us this excellent overview. We really appreciate it.
Oh, thank you. You know, an hour is a short time, so forgive me if I rushed through things too much, but I want to get as much information as possible.
Yeah, it's really been excellent, and I very much do appreciate it, as does the full committee. So I think we're ready to wrap up. I just want to say thank you to everybody who's joined us today. We'll get out the slides later today to those of you that were participants. If you wish to learn more about the League's juvenile justice team, you can visit the League of Women Voters of Washtenaw County's website under advocacy. And you are invited to join our planning session on February 14th at 9 a.m. via Zoom, if you wish. You would need to email justice@lwvwashtenaw.org in order to get the Zoom link. And that's it. We hope you have a great day. Thank you all for joining us.
Thanks, everybody.
Bye.